One of the early frontrunners for the 2020 Democratic presidential nomination, Senator Kamala Harris, has come out in support of a bill which would end all private health insurance and replace it with a so-called Medicare For All program run by the federal government. The bill is also supported by at least 3 other senators seeking the presidency who are likely to announce soon: Elizabeth Warren, Bernie Sanders, and Kirsten Gillibrand. I'm Tim Donner with 5 facts about Medicare for All and how it would drastically transform the entire American healthcare system. Fact 1. At least 160 million Americans would be moved from private insurance to a government-run program. This is why insurance companies and the healthcare industry will use the full weight of their considerable influence to oppose this plan. It was those corporate interests that benefited the most from Obamacare because of the government-mandated requirement that every American buy one of their products. Unfortunately for the previously uninsured, who were supposed to be the principal beneficiaries of Obamacare, most of the plans carry such high deductibles that they need a major medical incident or major illness for the plan to even kick in. Medicare for All would remove insurance companies altogether. Fact 2. Medicare for All will cost taxpayers over $30 trillion in the next 10 years. This is based on studies from the right-leaning Mercatus Center and left-leaning Urban Institute. This amounts to at least $3 trillion a year. The entire annual federal budget is around $4 trillion. So simple math reveals that Medicare for All alone would cost 75% of what the whole federal government is now spending in a whole year. And we already have a national debt of more than $21 trillion. Fact 3. Doctors and hospitals would experience huge losses. Medicare for All supporters are claiming that their plan would represent a lower ultimate cost to the nation because the private health insurance industry would no longer exist. But that estimate is also based on paying 40% less to healthcare providers than what they receive now from private insurance. So the obvious question arises: what effect would significantly lower government reimbursements and compliance with government regulation have on the quality of care, access to care, and the number of doctors entering a profession which would offer a smaller return on the huge amounts of money and time they must invest to get a medical degree? Fact 4. The current Medicare program has been running deficits almost since the day it started. Now, most people like their Medicare, but are blissfully unaware that the program has run up unfunded liabilities projected to be almost $40 trillion over the next 75 years. This is from the latest report from the government's own Medicare Trust Fund. $40 trillion in benefits the government has committed but has no way to pay for. It's the same problem that's threatening to overrun many state and local governments. Generous pensions and benefits promised to public unions that can be paid for in the years ahead only by increasing taxes and cutting government services. And Medicare for All would go much further than the current Medicare, as it would add coverage for emergency surgery, prescription drugs, and mental health care. And that brings us to fact 5. 80% of Americans like their current health care coverage. Despite perpetual widespread grumbling about insurance companies in general and health insurance providers in particular, numerous polls have confirmed that what was true before Obamacare is still true today. A huge majority of Americans are satisfied with the health care coverage they have. Make no mistake, Medicare for All would represent not a halfway measure like Obamacare, but a full-scale transformation of the entire American healthcare system. While Obamacare was managed by the government through private industry, Medicare for All would be fully controlled and operated by the federal government, with the private sector no longer involved. Please subscribe to the Liberty Nation YouTube channel, where you can get these 5 facts and Truth TV and author interviews and roundtables, plus Liberty Nation Radio and our podcast, The Uprising. I'm Tim Donner. Thanks for watching.